Oftentimes, when patients come to the practice, I'm taking an approach that allows me as a physician to understand the whole picture. And just like any profession, really having a big picture view from the top down, kind of looking at the entire scenario with a patient is really important. It's easy to kind of get lost in some of these specifics, or I think it's important that as the physician to really understand, well, what are the factors that are actually making the patient feel bad? What are the factors that make the patient feel better? And some of this is psychological. Some of this are physical, and some of these things are a little combination of both. And one of the things that we do here is some lab work. And you go to the doctor and they draw blood, and we get labs and things, and you never really know why that is. But our approach is tailored to the actual problem that you're coming in for. So for instance, if somebody comes in with nerve pain in their feet, and this has been a chronic issue and they haven't had any answers, it's really important, a standard of care in fact, to run blood tests in order to identify really simple things but that are reversible before even assuming that we have to just treat the pain. Treat the symptom and that's all we can do. That's not necessarily the case. It's really important to understand what is the basis behind the problem, and then if that's a treatable or reversible condition, then the focus needs to be on that. We wouldn't be neglecting the pain, of course. We can still treat that portion of the whole problem, but pain is, in that case, just a symptom of the underlying issue. So blood work is run. Sometimes we'll look at items like something called hemoglobin A1C, which checks for blood sugar management. We look at vitamin B12 levels. These are just simple examples of what deficiencies and when you have too many of sugars or glucose, for example, that can lead to neuropathies, and management of those conditions ought to be the primary focus then. We would never really know if that were the case if we didn't check for it. And the same kind of lab work we would institute for patients with other problems. We have panels that are designed specific to a given problem. So for example, memory disorders. If a patient comes in with a complaint of cognitive problems or memory problems, then one of the first things that we need to do is to draw blood and to examine the blood for specific reversible conditions before we start to make any kind of assumption that this is Alzheimer's disease or something that is very difficult to reverse. And so that's really the idea behind our laboratory. It's one of the first things that the patient will encounter following seeing the doctor and after being assessed by the doctor.